Thank you, Hannah.
Okay. Hello, everyone. Good morning and good afternoon for everyone, wherever you are from around the world, maybe from the UK to the Southeast Asia region. A warm welcome to the Nursing Now Challenge and Southeast Asia region launch of the State of the World's Nursing 2025 report. My name is Oki and I'm very honored to be your MC for today. We are thrilled to gather a truly global community today. Nursing leaders, early career nurses, policymakers, educators, midwives, students, and friends of professions. But before we begin, I have few quick housekeeping notes. First, please use the chat box to introduce yourself. Please let us know your name, where you're joining from, or your role. And second, the session is being recorded and will be available later on the Nursing Now Challenge YouTube channel. Third, we'll have a Q&A session at the end, but if you already have questions for our speaker, kindly type them in the Q&A box at any time during the session. And fourth, the official WHO global launch of SoWN 2025 report will take place today at 1 p.m. CET or 6 p.m. Jakarta time. So you can register via the link that will be shared in the chat box. And last, if you need translation, please just click the CC captioned on your screen and select your preferred language. Thank you once again for joining us, everyone, and we are very excited to begin this session. Now, to open this exciting gathering, please join me in welcoming Ratna Suryani Gandana. She is a Southeast Asia Regional Hub Lead and a member of the Challengers Committee to deliver her opening remarks. Ratna, the floor is yours. Please.
Okay, thank you so much. Hello, everyone. So happy International Nurses Day. And also on this International Nurses Day and the launch of the State of the World's Nursing 2025 reports, I call on the governments to listen to the heartbeat of the healthcare system, nurses. And we want everyone to know that let there be no marginalizations of nurses' voice in decision-making spaces. I also dream of the policy that is not only made for nurses, but also shaped by us. Ladies and gentlemen, so I want like the governments also move not only from the recognitions of nurses, but also the real investment on our job, on our educations, on our safety and our leadership. Ladies and gentlemen, nurses are not a cost. Nurses are a fundamental of the resilient, of equitable and sustainable of the healthcare system. So, ladies and gentlemen, we are all gathered here because we believe and we care about nursing professions, about midwifery professions. We want to make it better because we know that if we make the nursing professions and midwifery profession better, it will create a better healthcare system. We are here because we carry the voices of nurses from all around the world, the young, the bold, the ready, and the driven nurses. So, ladies and gentlemen, with data in our hands from the State of the World's Nursing reports, and also with the passion in our hearts, we can make this data into actions, and we can change, and we can lead the silence into voices, into change. So, ladies and gentlemen, this is our time. If not now, then when? And if not us, then who will? So, ladies and gentlemen, let's do it together. All of us, the governments, nursing professions, all of the stakeholders, to make the healthcare system better. By make the healthcare system better, we can make the world better. We can change the world to be a better place. And the key is in nursing and midwifery profession. So, ladies and gentlemen, let's join and let's enjoy this webinar, and let's move together toward a better place in this world. Thank you so much. I'm Ratna from Nursing Now Challenge. Let's move together now.
Okay, giving applause for Ratna. Thank you so much for giving such inspiring welcome, and I believe that our profession can thrive and excel in the future. Okay, now we'll move into our first presentation, the highlight of the State of the World's Nursing 2025 report, particularly for Southeast Asia region, and we are honored to welcome Tanimizu, Technical Officer for Nursing and Midwifery at WHO Southeast Asia region. Tanimizu, the time is yours.
Thank you very much, Oki, and thank you, Ratna, and thank you very much, Nursing Now, for the invitation. These 2 weeks are my favorite 2 weeks of the year because of the International Day of the Midwife celebrations and this day for International Nurses Day. And what a great timing to, be able to work with such passionate professionals such as yourself. So today I do have the honor to present on the State of the World's Nursing 2025 report that just came out today and talking about the key findings from our region. So if you can show the presentation, please. So my name is Tanimizu. I am the Technical Officer for Nursing and Midwifery at the Regional Office for Southeast Asia. Next slide, please. So just to give you a brief introduction on the Southeast Asia region, next slide, please. So we have 11 countries in the region, really ranging from Bangladesh, Bhutan, DPR, Korea, India, Indonesia, Maldives, Myanmar, Nepal, Sri Lanka, Thailand, and Timor-Leste. So we only have 11 countries, but the region contributes and we house 26% of the world's total population. So that's a huge amount. 1 in 4 people in the world actually live in our region. Next slide, please. So we only have 5 years left to the 2030 Sustainable Development Agenda, and central to the achievement to achieving these agenda for sustainable development is an adequate, equitably distributed, and fully supported health workforce. We, nurses, are the largest segment of the health workforce, and nurses can definitely drive progress on the SDGs, deliver universal health coverage and advance health equity, and ensure the resilience of health systems. We have been making good progress on improving UHC service coverage index from 47 in 2010 to 62 in 2021. However, the pace is inadequate to reach the target of 80 by 2030. Even before the pandemic, the progress was not fast enough, although the countries have been committing to achieve universal health coverage. When we look at financial protection, which is SDG target 3.8.2, we continue to face challenges. An estimated 326 million people are still facing catastrophic health spending, where out of pocket health expenses exceed 10% of the household expenditure. Next slide, please. The region has been making sustainable progress in reproductive, maternal, neonatal, and child health, also with immunization coverage and combating many infectious diseases. However, areas of concern are the rising prevalence of non communicable diseases, premature NCDs, continued increase in TB incidence rate, and rising mental health conditions, higher number of zero dose and partially vaccinated children, and disruptive measles outbreaks and mortality due to injuries as well. Regrettably, COVID-19 pandemic reversed nearly a decade of progress with life expectancy, which dropped by 3 years, and healthy life expectancy by 2.5 years between the years of 2019 and 2021. Next slide, please. All this data, next slide, please, underscores the importance of comprehensive primary healthcare oriented health systems. Next slide, please, which provides efficient, accessible, equitable, and community based care. UHC can be achieved by primary healthcare. It requires adequate numbers of competent health workers with optimal skills mix and who are equitably distributed, adequately supported, and can enjoy decent work. If you can click, the SoWN 2025, which was released today, provides the data to derive the needed policy actions and investments. Next slide, please. What do we see in this new report? Basically, in terms of education, 70% of our countries are reporting that they have 4-year nursing programs compared to 31% in the world. 50% of our nurses are below the age of 35 years, which I think represents today's webinar and the host. 80% of nurses in the region are women. And when we look at nursing leadership development programs, it has increased since the last report of 2020. So in 2020, we only had 40% countries saying that they have leadership development programs. Now it has increased to 67% because of all the advocacy. Currently, 50% of health workers are made up of nurses in our region, which is compared to 57% in the world or 64% in high income countries. And the density of nurses per 10,000 population has increased since the last report. So we went from 16.5% to 17.4 nurses per 10,000 population, compared to 37.1 in the world and 100.4 in high income countries. Next slide, please. When we look at working conditions, we have not received enough data on the national care packages for mental well-being of health workers. Only 3 countries out of the 11 reported or responded on this question, and 2 out of those 3 countries said that they have a package for mental well-being of health workers. When we look at mechanisms for in-kind remuneration to promote rural retention, only 2 countries responded, and out of which 1 country said yes. Next slide, please. A recurrent theme that we're seeing throughout the report is the persistent and worsening inequities. So of inequity is evident in the nursing distribution, density, education capacity, wages, and working conditions, and in existing and projected future shortages of nurses. So I'm just giving you here as an example. So we know we have calculated that there are 3.6 million nurses in our region, which makes up only 12.2% of the world's nursing population is in our region. Our density, as I said, is 17.4. However, if you look at the table on the right, you can see the inequities that exist throughout countries, within countries, and also within the countries as well. So even in the countries, we can see a geographical maldistribution of nurses. Next slide, please. The report gives us policy priorities, which are aligned to the strategic directions of nursing and midwifery. And for our region, we definitely want to focus more on quality. We know that the density is increasing, but we need to focus on ensuring that we have quality education, that the jobs are well remunerated, that we have good leadership, and that nurses can be fit for purpose for ensuring service delivery. If you can click, there are 5 additional areas as well on advanced practice nursing, digital health and technology, gender equality, climate agenda, and nursing and war and conflict that we see from the findings of the report. Next slide, please. The one aspect I want to focus for today's webinar is that 50% of the nurses in the region are aged 35 years or younger. Younger nurses are representing the future of the health systems, so we need to invest in the education, training, and professional development to ensure a robust and resilient health system for years to come. Younger nurses are more often adaptable to new technologies and innovative practices. Supporting their growth can lead to adoption of cutting-edge digital health solutions that improve patient outcomes. By investing in younger nurses, we are cultivating the next generation of leaders. We need to provide more opportunities for leadership training and mentorship that will empower them to take on critical roles in shaping the future of health systems. Younger workforce means a longer career span, so we need to invest in the well-being and professional satisfaction. 80% of our nurses are women, so investing in nursing is also an investment in women. A well-supported younger nursing workforce can also contribute to economic stability and growth. Next slide, please. So what can you do? Amidst these economic cutbacks, geopolitical crises, natural disasters, and climate-related crises, we find ourselves at a pivotal moment because we only have 5 years remaining. We can take this opportunity presented by this report to drive investments and actions at the country level to progress toward universal health coverage and the sustainable development goals. The findings provide policymakers, planners, employees, educators, regulators, health service managers, and nurses with data analysis and policy options to take forward in your countries and each context. So really, what can you do as a nurse yourself? You can review the SoWN report and review your country profile, which is given in the QR code. And you can advocate for policy reforms by using the evidence in the report by collaborating with your stakeholders. Next slide, please. Just want to say again, investing in nursing is not just a health priority, it is an economic imperative. By strengthening our nursing workforce, we can build more resilient health systems, improve patient care, and drive economic growth. And to the 3.6 million nurses in the region, thank you so much for your dedication to healing and compassionate care. Your unwavering commitment to providing exceptional care and advocacy is what makes a difference to the lives and communities you serve. Happy International Nurses Day, and we will see you at the official launch of the State of the World's Nursing later today. Thank you.
Okay, thank you so much, Tanimizu, for highlighting the key findings of SoWN, and also hopefully we could make a joint movement to invest better into nursing world. Now, let's bring in inspiring conversation with two incredible nursing leaders who will reflect on the report's implication and share their regional experience. We are joined by Abhilasha Donald, Program Advisor from Jepiego, India, and Arcelia Farosha, Nursing Coordinator for Service Integration, Research and Development at Dr. Cipto Mangunkusumo Hospital, Indonesia. The session will be moderated by Ernest Lamuel. He is also our Southeast Asia Regional Hub Leads. So, please welcome Ernest, Abhilasha, and Arcelia. The time is yours.
Thank you so much for this opportunity. And good morning, good afternoon, and good evening to everyone who is watching. A very, very happy International Nurses Day. And I'm so happy, I'm so excited for today. And thank you all for having me. So, for the first International Health Nurse Representative, a senior nurse representative for Abhilasha, I have a question for you. That Abhilasha, based on your policy experience, how do you see the SoWN 2025 supporting the case for stronger nursing leadership and workforce investment in the region?
Thank you, Ernest, for that question. And I wish everyone a very happy International Nurses Day. So, yeah, from a policy standpoint, SoWN 2025 is a critical tool for Southeast Asia. It helps us move from anecdote to evidence when making the case for stronger nursing leadership and workforce investment. First, the report, I think, clearly shows that while Southeast Asia has made gains in nurse production, we continue to face persistent workforce shortages, low nurse density, and limited absorption into the public sector. Without strategic investment, we risk a growing mismatch between health needs and workforce capacity, especially in the face of demographic shifts and rising NCDs. Where SoWN 2025 is especially powerful is in how it highlights leadership gaps. As my colleague I rightly said, that we have somehow increased in the countries reporting having leadership development programs for nurses, while most countries have government chief nursing officer. The report questions whether these roles have real decision-making power or resources. So this data is critical because it tells us that representation is not enough. We need structural report, clear mandates, and defined career pathways for nurses in leadership roles. The report also gives us policy levers, whether it's embedding leadership development in national health strategies, aligning with SDNM policy priorities, or using NHWA data to advocate for workforce investment compacts. It's not just a descriptive document. I believe it's an actionable framework we can take to ministries of health and finance. So to summarize, I think SoWN 2025 gives us the evidence, legitimacy, and urgency to advocate for better nursing leadership and more sustainable, equitable investment in the workforce, something that is not just a professional imperative, but a public health one. Thank you. I'll stop here.
Thank you, Abhilasha, for your perspective. And I have one more question for you, Abhilasha. That looking ahead, what policy shifts or strategic investments do you believe are most urgent to elevate the nursing profession in Southeast Asia?
Thank you for that question again, Ernest. I think we must invest in nursing leadership, not just in titles, but in tangible power and pathways. The SoWN 2025 report is unequivocal. Roles like government chief nursing officers must come with clear mandates, access to workforce data, and real budgetary influence. This is particularly vital for Southeast Asia, where nurses consistently lead at the point of care, yet remain excluded from the decision-making tables. Second, I think we need to close the education to employment employment gap. While many countries in our region are ramping up nursing education, we are failing to create sufficient funded positions to absorb new graduates. That mismatch risk wasting both talent and resources. We need coordinated strategic investments in faculty development, critical training infrastructure, and public sector hiring, I believe, especially in areas most in need. Training without employment is not progress, it's a missed opportunity, according to me. Third, I think we must embed nursing firmly within our region's broader health transformation agenda. That means enabling advanced nursing practitioner roles within primary healthcare, building digital competencies, and enacting legislation that protects fair wages, safe working conditions, and most importantly, mental well being. So, to summarize, I believe it's time to stop viewing nursing as a line item on the budget and start recognizing it as a strategic investment, not one that improve health outcomes, build resilient systems, and moves us faster towards achieving universal health coverage. Thank you.
Thank you, Bilasha, again for such a unique perspective. While listening to you, I just feel like an avenger in this modern world of nursing. Thank you. Thank you so much for accepting the invitation and representing the Southeast Asia region and expressing your perspective. Thank you so much. Now, moving on to our second international senior nurse representative from Southeast Asia, we have Celia, the clinical practice and research sector. So, Celia, hi, good morning.
Morning, Ernest. How are
Hi,
you?
hi. Yeah, so without
Yes,
wasting any time, I
yes.
would like to proceed with the question that I have for you is that from your background in clinical practice and research, how do the findings of SoWN 2025 resonate with the daily realities of nurses in your country?
Right, all right. Thank you very much, Ernest, for the question. So, from the perspective of nurse practitioners, I would like to highlight 3 points on my practice. The first one is the workforce challenges comparing to the complexity of the healthcare insurance, and then complexity of the patient conditions, and then to the um, infections control and everything. So we are faced by the shared competencies of nurses. This is one of the biggest challenge for us in hospitals. Uh, how the nurses with the shared competencies could cover those. There is a pro and contra around this. So this is, I think, we could dig more and explore more about this. So first is shared competencies, and then the second one is how the research result could be used high impact within the practice, the nursing practice. This is still our biggest challenges within the practice, because in Indonesia itself, we don't really have researcher nurse, unlike the UK and other developed countries. That's the second one. And then the third one is regarding the leadership. So I would like, in this very opportunity, I would like to thank Burdett Nursing Trust and then Nursing Now for the scholarship and the Harvard Leader for Nurses. So thank you very much for those, because those are really our opportunity, especially nurse practitioners in Indonesia. And I myself got the scholarship for this Harvard Global Nurse Leader. So that's really important for us in the clinical practice to have a more opportunity to join highly recommended university and have leadership skills. So those 3 points, Ernest, I would like to highlight.
Thank
It's
you.
biggest for us, yes.
Thank you, Arcelia. Again, I am so grateful for your perspective and how you have meticulously answered in each and every aspect of the question. Now, moving on to one additional question that I have for you is from your unique vantage points, what do you think that SoWN to 2025 report matters for Southeast Asia at this moment in time?
Well, I think this is, I think data collections and utilizations, especially for the SON report, is really important, especially for us in the clinical perspective. So we could really know where to move our outcome, move our leadership programs and everything within the transformations of nursing here in Indonesia. So in my institutions also, we've got these transformations of nursing. We try to combine SDGs and then climate change. And actually, I am now wearing the Ministry of Health because today we have a disaster drill for the climate change. So that's one point. So we really need those kind of data collection and utilizations. It's really important to set the clear outcome for
Mm.
people.
Yes, thank you
This
so
is
much, Arcelia, for presenting your views on this. And
thank you very
yes, thank you so much. So, with this, I would like to move on to the next section of our webinar. And thank you for having me. Thank you so much.
Okay, thank you so much for Avilasa, Arcelia, and also Ernest for the very thoughtful reflections and also about real life leadership experience. It's remind us how important leadership actually in every level. So thank you so much.
Thank you.
Now, we are honored to hear from two esteemed WHO collaborating centers for nursing midwifery development. We have Dr. Amarporn Ratinthorn, Dean of the Faculty of Nursing, Mahidol University, Thailand, and also Dr. Vinita Ravindran, the Dean of the College of Nursing, Christian Medical College, Vellore, India. We look forward to your thoughts on how WHOCC can support the momentum of this report. So, please welcome Dr. Ameporn and Dr. Vinita. The stage is yours.
Good morning, esteemed colleagues and partner. Thank you so much for having me here for the opportunity to share the reflection from the WHO Collaborating Center for Nursing and Midwifery Development at Faculty of Nursing, Mahidol University in Thailand. And to speak on behalf of WHO Southeast Asian regions, we are eagerly looking forward to the release of State of the World Nursing Report 2025, even before its official launch in some countries. We recognize that such a report will carry messages that are very crucial for guiding the next phase of nursing workforce development globally and regionally. Across our region, we can see that we face a range of the enduring challenges, including shortage and maldistribution of nurses, limited access to continuous professional development, gaps in research and innovation, and the urgent need to modernize nursing education and leadership to respond to the increasingly complex healthcare needs. At our collaborating center, we address this challenge through several key areas of work. We provide specialized training for nurses and midwives, focusing on gerontological nursing and caring for individuals with non-communicable diseases, or NCD. Importantly, we are now focusing on the growing issue of multimorbidity in NCD, recognizing that many patients live with multiple chronic conditions that require integrated, person-centered approaches. We see nurses play a vital role in this area, and we are looking forward to build their capacity accordingly. We also work to strengthen research and innovation skills, such as through our recent training in systematic review methodology, which support nurses in applying evidence to their practice and policy. In addition, we support nurse educator development, including training in interprofessional education, or IPE, to help prepare future health professionals for collaborative team-based care models. We hope that the State of World Nursing Report 2025 will amplify this priority, highlighting the importance of investment in specialized skill, research capacity, and educational reform. We are particularly eager to see recognition of nurses' expanding roles in chronic disease management and their potential to lead innovative, integrated for complex conditions like multimorbidity. Importantly, we also look forward to the report's role in shaping evidence-based policy. The data and recommendation can serve as a foundation for national strategy addressing persistent workforce challenges. As a WHO collaborating center, we emphasize the critical need for more research on working conditions and the mental health and well-being of nurses in the regions. These issues are often overlooked, yet they are essential to building a sustainable and resilient nursing workforce that can respond effectively in both routine and emergency conditions. This report is not just a collecting of data, it's a tool that can help drive real-world change. We plan to use its messages to shape our future activity, support countries as they improve their nursing workforce, and advance the goal of global strategic direction for nursing and midwifery. Together with WHO and the global WHO-CC network, we are committed to translating its findings into action, ensuring that nurses and midwives are equipped, empowered, and supported to lead health system transformation. Thank you very much.
Thank you very much, Dr. Ratinsorn. And now we can hear from Dr. Ravindran. The stage is yours. Please, Doctor.
Dear colleagues in nursing and friends across the globe, it's a pleasure to have this opportunity to say a few words about the challenges we face in our countries, in SEARO region, particularly India and the WHO support, and also the contribution to nursing as a WHOCC center addressing these issues through the strategic directions that are given by the WHO. The World Health Organization has played a vital role in supporting and advancing the nursing profession globally. It has consistently advocated for stronger investment in nursing education, leadership, and workforce development, recognizing nurses as essential to achieving universal health coverage and the sustainable goals. In 2020, the WHO declared as the International Year of the Nurse and Midwife, honoring their contributions and drawing global attention to the challenges they face. WHO has done or given many initiatives that underscores the critical role of nurses in delivering high-quality, equitable healthcare worldwide. We therefore find it an honor to be part of WHO as a collaborating center. And we are indeed happy to receive the SoWN report 2025 today, which gives us further directions for us to direct our activities. Some of the challenges that have been addressed in the SoWN report, I just would like to highlight. We in India and in our countries in SEARO are still shortage of nurses. Our population ratio, nurse to population ratio is still about 1.7 to 2 per thousand, which is much below what is recommended and what we see now in the report. We are at the lower end of the spectrum. There's still uneven distribution of nursing workforce, especially less people in our country in the rural areas. And so this contributes to poor access to care in marginalized communities. There are a lot of educational inequities as well. Some districts have lack of educational institution, while others have plenty, and this again causes manpower problems, supplying manpower. There are also poor working conditions that we know. There's so much of improvement in that according to our 2025 report, but there's still a lot to improve on. There's limited career advancement. The Indian Nursing Council, actually with the Ministry of Health and Family Welfare, has rolled out NP curriculums, but the problem or the challenge is how it has to be implemented or how it can be implemented. The migration is a great problem and a challenge in some of our countries, Philippines, Indonesia, and India. And this really takes away the skilled professionals from our own countries, and this exacerbates the domestic shortage of nurses. There's also social stigma, and I'm glad this is addressed in the 2025 report. Still nursing is considered subordinate in some of our countries, especially in India. And male nurses face stigma, while female nurses often face gender discrimination, especially in leadership position. And there is inconsistent data and health workforce planning, lack of positions in different workforce levels, and policy level engagement is also very low. There has been, of course, many initiatives in our country. I just would like to mention a few when we are talking about our centers, WHOCC. There's been an effort to increase the number of nursing colleges so we can produce more nurses. The country has really established plan to open new nursing colleges, especially in districts which lack nursing colleges. And there is regulatory and reforms in workforce development in place with the new National Nursing and Midwifery Commission in India. There is initiatives to make sure that there is international migration, but safe international migration through policies and procedures. And there have been many efforts put in place on improving working conditions and retention of nurses by decreasing the work hours or improving work environments and ecosystems. There's also a lot of improvement in education, especially facilitating faculty in different colleges to make sure that they are up to date with the knowledge on pedagogies. As a WHOCC College of Nursing CMC Vellore, we work hard to align the center's activities to the strategic directions of WHO and the country's efforts in empowering nurses and strengthening nursing and midwifery. This we do keeping in mind the status of world nurses, particularly in the SEARO regions. The highlights are the training of nursing faculty in curriculum implementation, clinical learning, research, and facilitating especially observational visits for faculty and students from other nursing institutions from within and outside the country. WHOCC, we also partner with the government and the WHO centers of the SEARO region to facilitate training in specific specialty areas by tailoring courses according to their needs. Our dual role in CMC Vellore as faculty and nurse manager enables our faculty to be excellent teachers for the nurses to train them effectively in clinical specialties. And this we do consistently for institutions across India. The community health model needs special mention. It's based on which we deliver nurse-run community health program here in our center. And this effect and the effectiveness of this nurse-run program that we are conducting for many years is being evaluated right now with a view to project it as an effective model of public health initiative in combating mortality and morbidity rate, especially in MCH and in NCDs. And we hope to put this forward to WHO very soon. In conclusion, we look forward to working with WHO, and it's a pleasure to be a WHOCC. And we hope to move forward in taking the agenda and the points that have been displayed in the report 2025, SoWN report 2025, in empowering nursing and midwifery workforce. We look forward to the complete report soon. Thank you for the opportunity.
Okay, thank you so much, Dr. Tintarn and Dr. Ravindran for sharing the WHOCC support for our region. This support meaning very much for advancing our research, education, and practice across the region. Thank you. Now, let's hear from the next generation of nursing leaders with two early careers nurses who will share their personal perspective, their journeys, what it means to lead the change, and their future hopes for nurses. We have Srijana Manandar, registered nurse from Nepal, and also Rika Widyaning Tias, the CEO and founder of Study Abroad Center, and also lecturer in Nursing Science Department at Diponegoro University, Indonesia. We are excited to hear your voice, but before we go this session, it will be also moderated by Ernest Lamuel. So please welcome Ernest, Sarijana, and Rika. The stage is yours.
Hello, I am here again. Sorry. So I am again grateful that I am also moderating the new nurses and the early career nurses, and that is I am myself an early career nurse. So I'm always very much happy and looking forward to talking with the early career nurses. So the first in a Southeast Asian representative early career nurse from Nepal, we have Srijana Manandar. And the first question that I have for you is, hi Srijana, can you hear me? Do we have Srijana with us?
Yes, she's with us, but I think the video is still off.
Oh,
Could you
Srijana,
please off?
hi Srijana, can you hear me? Well, I'll give her some time. Maybe she wants to get some water or something like me. So I'll move on to our second international Southeast Asian.
Hi, is it
Hi.
my voice clear? Yeah,
Yeah,
hi.
hi Raika. Hi, welcome, and good morning to you. So, can you tell us a little bit about your journey into nursing and what inspired you to choose this path?
Okay, thank you so much. It's good morning, everyone. It's truly an honor to be here today, especially among fellow passionate nurse and healthcare professionals shaping the future nursing in Southeast Asia. I'm Rika. I'm a nurse educator from Indonesia, currently a lecturer at Universitas Diponegoro, and also I'm the founder of Study Abroad Center Indonesia, an organization that supports young Indonesian, especially nurses, to pursue global education through mentorship and scholarship. Talking about the first question from Anna, so my journey into nursing started with a dream to be a teacher. But along the way, I found my self drawn to the nursing because it's direct a human-centered impact. I completed my bachelor and also nursing in Indonesia. So we completed 5 years to be professional and registered nurse with fully funded scholarship. Then I pursued my master degree as well in the UK in University of Dundee, also with fully funded scholarship. So what inspired me the most about nursing? It's our mission, helping people. During my time as practicing nurse, I realized I could only impact a few lives at a time through clinical care. But when I step it into education, when I become a lecturer, my dream of become teacher comes true. But instead of teaching in general classroom, I now teach and mentor future nurses, helping them shape their skills, mindset, and also leadership potential. Thank you so much.
Thank you, Raika. And what has your first year or two in the nursing profession taught you about yourself? I would like to ask.
Okay. I always at the first initial career, it's about I think to inspire others, especially about leadership. So during my time as a student, I think I was involved several volunteer programs and student organization and project-based leadership. So as a young academic and founder of Education Flavor, I continue that spirit. But at this moment, my key initiative is a study work center, SIC Indonesia, able to help Indonesian students, including nurses, okay, to global education mentorship and scholarship. And we support them to pursue their study abroad, growing their networks, and also contributes to Dream Picker.
Thank you, Raika.
Yeah.
Thank you again, sir. I'm so grateful for your contribution and to be able to represent Southeast Asia as an early career nurse. That is such an honor, and we are honored to have you. If do we have Srijana now? Hello, hi Srijana. Good morning.
Hello. Hello,
Hi,
good morning.
happy International Nurses Day. So I have the same question for you as well for the beginning. That can you tell us a little bit about your journey into nursing and what inspired you to choose this path?
Okay. Thank you for the question. I am Srijana from Nepal and I have completed Bachelor of Nursing from Nepal and I have been working as a rehabilitation nurse from since 10 years. And my journey into nursing was influenced by the mixed personal experience and deep desire to make a meaningful impact. Growing up, I watched a close membership go through the serious illness, and it was a compassion, knowledge, and calm presence of nurses left a lasting impression. And I witnessed how nurses were often the first to comfort patients, the one who coordinating care, and the one who stay by the patient side through the both calm and crisis. That experience inspired me pursuing a nursing career through compassion, critical thinking, human connection, etc. That's come together every day. And it's a profession rooted in empathy, advocacy, and continuous learning, all value that related deeply with me. The early stage of my nursing career has been incredibly eye-opening. I have learned that I am more resilient and adaptable than I ever thought. I have discovered that I am capable of handling high-pressure situations, making quick but thoughtful decisions, and advocating falsely for my patient. No amount of the schooling can fully prepare for emotional and physical demand for real world nursing. But facing those challenges has helped me grow. Nursing has taught me to confident in my abilities, flexible in face of challenges, and growth in empathy. It's a journey of constant learning. It's an understanding that I choose the right path. So I have found a deep sense of purpose in being there for people during some of the most memorable of their lives. One of the challenges I faced as a nurse, young nurse, managing an overwhelming responsibility that comes with patient care, especially during the busy shift where there's little time to pursue. Early on, I struggled with self-doubt, wondering if I was making right decision or doing enough for my person. To overcome this, I leaned heavily on my support system, experience, colleagues, mentor, and perception, who offer guidance and reassurance. I also learned the importance of asking questions and giving myself a grace and due into the role. As there is a moment where I questioned my career path, especially during the emotional adjusting there after witnessing heartbreak patient outcome. What helped me grounded was remembering what I chose nursing to make a difference. A small moment like the patient gratitude or family member kind word reminding me the impact we have. I also struggle in connecting with the fellow nurses who understood the challenges and celebrate the wins, no matter how small. Those relationships, along with self-care reflection, help me keep positive and stay communicated. Thank you.
Thank you, Sijana, and we wish you all the very best for your future and for your career. Now, moving on to the next section of our webinar, which is a Q&A section, and I welcome all the four speakers, Abhilasha, Aselia, Srijana, and Raika, if you would like to answer the questions. And the first question that I have is, as a nursing student, I am currently worried about the future of my job. So in my country, the public's view is bad and wages are still not commensurate with the standard. So many of us want to leave the country to become international nurses rather than work in our own country. How can this problem be made a priority and a strategy for solving it so that it is not left alone by the government and related organization? I welcome all four speakers to express their perspective. Anyone is open to take that
Yeah,
question.
so I would like to go because
Thank you,
there was
Abhilasha.
a
Thank you.
question on the chat box as well. Yeah,
Yeah.
so first of all, thank you for raising this important and honest concern. Your situation reflects a challenge faced by many young healthcare professionals, and not just in Indonesia, but around the world. And to make this issue a national priority, there must be a stronger collaboration between the government, healthcare institutions, and educational bodies. This means, implementing strategies that include better wage structures, improving working conditions, and launching public campaigns to elevate an image and respect of the nursing professionals. Nursing must be recognized not as a job, but as a critical pillar of the healthcare system. And I'm confident that with your voice and those of your peers can really help influence policy when it's consistently raised through student organizational, professional associations, and public forum like this. And change starts with awareness, but it takes collective effort and persistent advocacy to turn that awareness into action. So I believe that, yes, you will voice it with a lot of collaboration in your country. Thank you.
Thank you, Vilasha, for taking the question. I do have one more question. This is from Aninda Falahaini. I'm so sorry for for the wrong pronunciation. Hello, I'm Aninda from Indonesia. Nurses represent the largest proportion of the healthcare force. How can we leverage this strength to ensure our voices are heard and to make a meaningful impact in clinical and other healthcare settings? I welcome all of the speakers who would like to answer this question.
Yes, if I could
Yes,
just
thank
share.
you, Arcelia. Thank you.
Yes, right. Okay, thank you very much, Anida. So this is from my own experience and my other colleagues' experience as a nurse. So there is no other way than we need to leverage our positions into the policymaker. I would say that. So we need to increase our capacity and then become the policymakers. And then I also seen the impact of becoming a policymaker. We have a more you can say like the policy and everything, and we can implement it into our nursing practice and other wider context. So thank you, Ernest.
Thank you so much, Arcelia, for answering that question. And I would request the viewers, if you have any more additional questions, we are now happy to take them. I can see that there's one more. Hello, first of all, thank you for organizing this wonderful session. Thank you for having us and thank you for watching. I am a nurse educator from Sri Lanka. I would like to know how to join with the Southeast Asia as my country also in the Southeast Asia. Please let me know. Thank you. Thank you very much. I am sure that we are having representatives from Sri Lanka, and if not, then you are very welcome to mail us. I'll just type in the chat box that you can mail, and then you can join the Nursing Now Global Campaign and probably the Challenges Committee. So with this, I think we are done with our session, and thank you all for in Southeast Asia nurse representatives. I'm genuinely grateful for your time and your presence. Thank you so much. Thank you.
Thank you so much. Wow. Thank you so much. It's really a very powerful discussion that we have today, and it's really I'm really grateful to witness nurses leading the movement in the world. I mean, like, we can start it from ourselves and then empower others, and we can make nursing better in the future. Wow. Now, to provide a country-level response and next steps, we invite Ana Kurniati, the Director for the Provision of Human Resources for Health for Ministry of Health Republic of Indonesia, to help us understand how this report can inform policy actions and workforce strategies in the future. We warmly welcome Ana Kurniati. The floor is yours, please.
Thank you. Happy International Nurses Day, everyone. I'm Ana Kurniati, the Director of Health Workforce Provision from the MOH of the Republic of Indonesia. I'm so happy to meet all of you today in this very powerful webinar. And I also would like to congratulate all of you for the launching of the State of the World Nursing 2025 report. And today I do really enjoy all perspectives delivered by all distinguished speakers, and also some questions being asked by all participants and addressed very well. So it is really an honor for me to join with all of you today and also share some thoughts of the key takeaways from this report, as well as to share with you the Indonesian context related to the World Nursing Report. First of all, I would like also to emphasize that this report already provides a clear picture for all of us with a comprehensive framework about the global nursing workforce, including the situation in the Southeast Asia region, and provide us some insights on education, employment, migration, regulation, working conditions, leadership, and more challenges issues already addressed in this report. I think we can see that despite the number of nursing workforce increases, we still face some challenges in terms of shortage in some regions, in some countries, and also maldistribution still persisted between urban and rural and even between nations. In Indonesia context, I do really look forward to have the WHO Nursing Midwifery Collaborating Center, which involves 38 MOH health polytechnics as the nursing education institutions. For this achievement, I would like to thank to WHO Indonesia and WHO SEARO, and especially Ibu Ai Tanimizu for your tremendous support that makes this collaborating center happen in Indonesia. I think this platform is very important, and it's collaborate and it's also collaborate with many nurses and midwives as well, not only from Indonesia but also with our neighboring countries. So we can say that this is a very important platform that engages all international as well as national and local stakeholders all in one platform. So I would like to say that. From this report, we can learn that, and we can also together make some actions. First, regarding the promotion of employment for nurses. In Indonesia context, as our data is mostly predominantly from the public sector, we can say that almost 70% of our nurses working in public sector. However, when we look at to the data from the Indonesia Health Council, we can see that we have more than 600,000 nurses who actively registered in the Indonesia Health Council, and many of them not only working at the public sector, but we project that they also work in the private sector. So I think using this platform, we should promote that creation of job employment, not only thinking about the public sector, but also a private sector. And the second is we also consider about the shortage globally of nurses, so that international migration should also be should not be seen from the negative perspective. If the migration is appropriately managed and facilitated by both government and private sector. And as we also can understand from the report that the nursing workforce education level varies among countries. In Indonesia, most of the nursing workforce consists of associate nursing workforce who graduate from the diploma 3 level from the higher education, and some of them graduated from our health polytechnics. And approximately maybe around nearly 40%, nearly 30%, they graduate from the bachelor degree level. So it is very important that despite the different education system, different level of education, the most important thing is to all education system should address challenges related to the global burden of disease, as well as the local health issues and the advancement in knowledge and technology. And the production should be should match with the demand of the health service and as well as the population. In Indonesia, we are now facing the growing elderly population. So that's why our nursing education system now also incorporate elderly care in our curriculum. Also, we put some priority on how to manage catastrophic diseases like from cancer, stroke, cardiology, and also other kidney diseases to be taken into account in our education system for nursing workforce as well. And lastly, I would like to also mention about the leadership. as the largest group of health professional and also female are dominant in nursing workforce, I think nurses should take leadership in shaping the health policy and development agenda to make sure a better quality of care and also ultimately healthier world. Therefore, we need to equip all nurses with leadership skills in various settings, not only in health facility settings, but also for health policy at the country level and also at the world level. And I do hope that more and more nurses become the world leaders, whether in the government, other international development partners, or even in their own organization setting. So finally, I applaud the tagline of this report, engage, empower, and act. I think this is really fundamental, and it is true that findings of this report should be taken into consideration and action by all stakeholders all together. Thank you very much, and good day, everyone.
Thank you so much, Ibu Ana, for sharing the commitment to strengthening the nursing workforce across Indonesia. We really appreciate your support and engagement with nursing workforce for advanced health development in our country. Now, to close this powerful session, we are honored to welcome the global voice behind the Nursing Now Challenge, Professor Aisha Holloway, the Program Director of the Nursing Now Challenge. She is truly an inspiration for many. So please join me in welcoming Professor Aisha Holloway. Aisha, the floor is yours.
Thank you, thank you. I mean, SEARO region, you have not let yourself down. You have launched the world. You have launched State of the World's Nursing. You have done it with poise, with professionalism. Your guests were stellar, the lineup, everyone absolutely amazing. I'm just going to tell you, we have had Philippines, Indonesia, India, Thailand, Nepal, Sri Lanka. You have done your region proud. We are short for time, so I'm going to first of all thank all our guest speakers, from I to the WHO Collaborating Centre, Ministry of Health. I mean, all of you are young nurses. What has been your experience? So key messages, let's think now, action. Okay, so what I'm hearing is density, quality, investment, advocacy, SoWN as a tool for change, transformation, findings into action. All stakeholders have a responsibility, collaboration, working together. The status quo is no longer viable. This is now the time at all levels to take action. Wonderful. You acknowledge that the country National Health Workforce Accounts profiles are there. Please engage with them. I love this idea that this is, I'm looking, I have pages of notes here about the evidence, anecdote to evidence. We now have a roadmap for transformation in the SoWN report. Please read it. Please share it. It's not enough that it's just us, it's you. It has to be everyone, all stakeholders, regulators, employers, governments. They have specific challenges. They need to address them, but we do so together. Please make this your next step. Please join the official launch later today, WHO launch. It's in the chat. Register now. This is not enough. You can join all the other regions today. Find out what's happening in your other regions. We are a global workforce. We need to work together, collaborate together, engage, empower, act. Do it now. Thank you, everyone, and have a fantastic day.
Oh my God, thank you so much, Aisha, for your energy and your unwavering leadership, and for reminding us that every nurse has the power to lead. Now is the time to take the real action, to share, to empower, to keep inspire others. Truly, your words inspire every nurse to step forward and lead the change no matter where they are. Thank you.
We do it. We lead the change. Come on.
Yes, we can do it. Okay.
Well done, SEARO. Thank you, Thank you, everyone. Ernest,
Thank you,
Ratna.
Aisha.
Thank you,
Bye.
Aisha.
Thank you.
Wait a minute. Before we officially close this session, we have an exciting announcement first. We will launch the video challenge for Nursing Now Challenge on Southeast Asia region. So please join Nursing Now Challenge campaign. Follow our social media for more details and also for challenges and for community stories. We also will have upcoming webinars, so stay tuned on our social media. Second, the session is already recorded, so it will be available on Nursing Now Challenge YouTube channel. And the last one, don't miss the official WHO global launch of the SoWN report at 1 p.m. CET or 6 p.m. Jakarta time, okay? The link is in the chat, so do not miss it, okay? So from all of us in here at Southeast Asia region and the Nursing Now Challenge, thank you so much for being with us today, and more importantly, for being the part of the movement to raise the voice of nursing around the world. Let's keep nursing future with leadership, evidence, and action. Until the next time, take care and keep leading with heart. Goodbye and happy International Nurses Day, everyone.
Happy International
Happy
Nurses Day
International
to
Nurses
Happy
everyone.
International
Day.
Day.
Happy International
Thank you,
Nurses
everyone.
Happy International
Day.
Day.
Happy International
Thank
Nurses Day,
you.
everyone. Thank you so
Bye.
much.
Well
Thank
done.
you.